Miacalcin Vial is a medication that is used to treat certain bone problems such as Paget's disease and postmenopausal osteoporosis. It can also help to reduce high blood levels of calcium. This medication contains a man-made hormone called calcitonin, which works by slowing down bone loss and maintaining normal calcium levels in the blood. It may also provide relief from bone pain in people who have Paget's disease. The recommended daily dosage and optimal timing for taking Miacalcin Vial should be discussed with your healthcare provider. This medication is given by injection under the skin or into a muscle as directed by your doctor. For the treatment of high calcium, you will usually use this medication every 12 hours. For the treatment of osteoporosis, you will usually use this medication every other day. For the treatment of Paget's disease, you will usually use this medication daily to every other day. If you are using more than 2 milliliters of the medication at a time, it is recommended that you inject the medication into a muscle. The dosage is based on your medical condition and response to treatment. For the treatment of high calcium, the dosage is also based on weight. It is recommended to use this medication at the lowest effective dosage and for the shortest possible duration to treat your condition. Patients treated long-term with this medication have shown a rare risk of developing cancer. Discuss with your doctor the benefits and risks of long-term treatment with this medication. Before injecting each dose, check this product visually for particles or discoloration. If either is present, do not use the liquid. Also, clean the injection site with rubbing alcohol before injecting. It is important to change the location of the injection site each time to avoid problem areas under the skin or in the muscle. Use this medication regularly in order to get the most benefit from it. To help you remember, use it at the same times each day. If you are using this medication on a schedule other than every day, such as every other day, it may help to mark your calendar with a reminder. Learn how to store and discard needles and medical supplies safely. Consult your pharmacist. Tell your doctor if your condition lasts or gets worse. Side effects of Miacalcin Vial may include nausea, abdominal pain, diarrhea, vomiting, or flushing. Taking this medication at bedtime may help decrease these side effects. You may also experience swelling or redness at the injection site, a salty taste in the mouth, increased urination, or loss of appetite. If any of these effects last or worsen, contact your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, you should tell your doctor right away if you experience any serious side effects, such as eye pain, swelling ankles or feet, muscle cramps or spasms, or numbness/tingling of the arms or legs. In very rare cases, a serious allergic reaction may occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you experience any side effects, you can report them to the FDA in the US at 1-800-FDA-1088, or in Canada to Health Canada at 1-866-234-2345. Before you start using Miacalcin Vial, make sure to inform your doctor or pharmacist if you have any allergies to this medication or any other substances. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have a low level of calcium in your blood. If you have any upcoming surgery, it's important to let your doctor or dentist know about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Miacalcin Vial should only be used if it is clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication during pregnancy. It is not known whether this medication passes into breast milk, so if you are breastfeeding, be sure to consult your doctor before using Miacalcin Vial. When taking Miacalcin Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with Miacalcin Vial is lithium. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone has taken too much Miacalcin Vial and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include nausea and vomiting. As with any medication, it's important to take Miacalcin Vial as prescribed by your healthcare provider and not exceed the recommended dosage. Always consult with your doctor for the best timing to take this medication and to ensure it's the right option for your specific needs. It is important not to share Miacalcin Vial with others. In addition to taking Miacalcin Vial, it is also important to make lifestyle changes that promote healthy bones, such as increasing weight-bearing exercise, quitting smoking, limiting alcohol intake, and eating a well-balanced diet that includes enough calcium and vitamin D. Your doctor may also recommend taking calcium and vitamin D supplements, so it's best to consult with them for specific advice. While using this medication, your doctor may require you to undergo lab and/or medical tests, such as urine sediment, bone mineral density, and calcium levels. It is important to attend all medical and lab appointments. For more details, consult with your doctor. When taking Miacalcin Vial, it is important to follow the dosage instructions provided by your doctor. Additionally, it is best to take this medication at the same time each day for optimal results. If you forget to take a dose of Miacalcin Vial, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. Don't take a double dose to make up for the missed one. Remember to store Miacalcin Vial in the refrigerator, but make sure not to freeze it. Keep all medications out of reach of children and pets. When you no longer need the medication or it has expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. Never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.